that performs the function of excretion. So that performs the function of excretion, which means they help in the removal of the discharging waste. So as the name suggests, excretory system, so it will be excreting the waste from our body. So the excretory system is responsible for the elimination of wastes which is produced by hemostasis. If I talk about the main functions of the excretory system, then it is the eliminating of the waste products such as the urea, urine, uric acid and other chemical products via the urine. It also maintains the osmotic level and of blood and the plasma, and also maintain the electrolyte balance of the body. So here we will be discussing about the disorders of the excretory system. Now what are the disorders? We will be discussing that in detail. So let's start with the first slide of introduction. That excretory system, which is the main function, is responsible for the elimination of waste from the body of an organism. So organs such as liver, kidney, sweat glands, they eliminate the nitrogenous waste from the body. So any disorder in the excretory system, it will lead to the accumulation of the nitrogenous wastes in the body, and that may lead to certain diseases. So there is a list of excretory system disorders of list of excretory systems, that are uremia, renal failure, edema, diabetes insipidus, hypertension due to renin secretion, then renal tubular acidosis, Bright's disease, or a kidney stone. So these are all the disorders of the excretory system. So we will be discussing each of these disorders in detail. So first we will be studying is about the uremia. So uremia, it is a chemical condition. It is a clinical condition which is characterized by high level of urea in the blood. So as the name suggests, there will be a very high level of urea accumulation in the body, in the blood. So in such patients, excess urea is removed by hemodialysis. So this is the condition through which the excess urea will be removed from the body. So if I ask you what is urea, then urea, it is an important component of the urine. So the word uremia refers to urine in the blood, and uremia is a chronic kidney disease at later stages and also may happen either by acute renal failure or by kidney injury. So this is what uremia is. Now the unit contains a porous membrane which allows the passage of molecules on the basis of the concentration gradient. So this is about the uremia. If there is an excess of uremia in the patient's body, then it will be removed through the hemodialysis process. So in hemodialysis, what is happening? The blood is drained carefully from whichever artery it is convenient, and it is sent to the dialyzing unit. So this is what is uremia. Next I will talk about is the renal failure. So renal failure is the decrease or in the glomerular filtration in the humans. So if I tell you the definition of renal failure, then it will be renal failure or kidney failure is the condition where the kidneys do not function properly. So it is considered when the kidneys do not function properly. So both the kidneys, they are damaged and they stop working in case of acute renal failure. Now the main feature of acute renal failure is scanty urine production. There is a kidney transplant which is the ultimate treatment for the renal failure or the kidney failure. So this process is elaborate and relies heavily on the availability of a kidney from a donor. So that will be dependent on the donor If there is a match, then the kidney transplant could be happening. Now, there are numerous complications that occur in case of kidney transplant. So, to avoid these, the kidney from a close or distant relative is preferred. So, in this we are talking about the transplant of the kidney. We are talking about the donor here. But due to the modern technology, there are complications that are related to kidney transplant have been reduced to a greater deal. So this is the treatment part of the renal failure. Now, if I talk about the causes of the renal failure, or what are the factors that might cause renal failure, that will be, there can be some acute or chronic diseases, there can be excessive dehydration, then kidney trauma, and exposure to pollutants or excessive medicines. So these are the causes of the renal failure, and renal failure can be acute as well as chronic. So these are some of the causes which are listed here. So what are the causes here? There is a sudden and severe drop in blood pressure, or interpretation of blood flow to the kidneys from a severe injury or illness. So this is the first cause of the renal failure, acute renal failure. So I have told you that renal failure has been divided into two parts, that is the acute part and the chronic part. So here we are talking about the acute renal failure. The second cause may be, there can be a direct damage to the kidney by inflammation, toxins, drugs, infections, or reduced blood supply. So this is the second cause. Third is the sudden obstruction of urine flow due to enlarged prostate, kidney stones, bladder, tumor, or injury. So this is the third cause of the renal failure. So the prostate, which here I am talking about, is represented here. So all this is a diagram of kidney, and it is showing that how the urine is flowing from it and what are the paths through which the urine is will flow. And this is the blood flow. These are the two kidneys which are being represented here, and this is the ureter and prostate. There is a bladder and urethra. So these are the causes of the renal failure. Next, I will talk about is the renal calculi or kidney stones. So what are these? So kidney stones, they are the result of the deposition of the dissolved minerals or insoluble salts on the lining of the kidney. So they are the kidney stones here. So they will increase in size and cause immense pain in the patients when passed. So the kidney stones can vary in different sizes, and when they passed out from the patient's body, it may cause a pain to the patient. So now here it is an infographic which is showing the treatment, causes, and symptoms of the kidney failure. So as you can see this here, the medicines can be the treatment for the kidney failure. Ultrasound shock waves can be the treatment, and if there is a very much problem, then it you may go and see a doctor. Now, what are the causes of the kidney failure? So, not drinking enough water is one of the cause of the kidney failure. It can be genetic also, due to overweight also, because of the excess of the cholesterol or fat deposition in the body, it may lead to the kidney stones. The amount of junk food or the oily food which you eat may lead to kidney stones, and various medications also lead to kidney stones. Now, what are the symptoms of the kidney stones here? The kidney stones may lead to vomiting, backache, fever, painful urination, and blood in the urine. So these things may cause the kidney stones. Next is about the Bright's disease. So here what is happening? It is a disorder in which there is a nephritis, which is generally the inflammation of the kidney. So glomerulonephritis, it is characterized by inflammation in the glomeruli of the kidney. So in this case, they are completely filled in the blood, and if they become non-functional, the patients may need a artificial kidney. So it is such a disorder that if these glomeruli that are present in the excretory system on the kidneys, so if they become non-functional, the patient may need the artificial kidney. The next is the hypertension due to the renin secretion. So hypertension is basically the high blood pressure, which is a serious health problem, and it is and uh, it is the abnormal high blood pressure and a combination of high physiological stress, which is known as the hypertension. Now, hypertension due to renin secretion. So when there is a high amount of renin which is being secreted, it may result into the formation of angiotensins, which may lead to the hypertension. So this is what the renin secretion in case of the hypertension. Now, the renal tubular acidosis. So it is also a disorder of the excretory system. So in this, the person is unable to secrete optimum quantity of hydrogen ions, due to which there is a large amount of sodium bicarbonate ions which are lost during the urination. So this is one of the excretory system disorder in which there is a large amount of bicarbonate ions which are lost during the urination. The next I will talk about is the diabetes insipidus. So diabetes insipidus is one of the rare disorders. It results due to the deficiency of antidiuretic hormone. So in this condition, the hormone leads to the reabsorption of water by distal parts of the nephrons and thus prevents diuresis, which is the urine production. So the deficiency in the ADH secretion results in the excessive production of dilute urine and intense thirst. So in case of diabetes insipidus, the kidneys could not control the fluid in the body. So this is the picture which is representing, there is a puberty gland and there is a kidney also. So puberty gland is in the brain, so it is represented as a magnified view. And here it is a condition in which the puberty gland produces insufficient ADH and hence the kidney makes a lot of urine. So this is the condition. Now, if I talk about some of the causes, then the causes can be our kidney, they functions by filtering the blood multiple times. So only a little amount of concentrated urine is released and most of the water is reabsorbed. So diabetes insipidus happens when the kidney are not able to concentrate the urine appropriately due to a lot of dilute urine which is being excreted. So this is occurred by the lack of ADH, which is known as the central diabetes insipidus. So when this diabetes insipidus occurred due to the failure of the kidneys to respond towards ADH, this particular condition is known as the nephrogenic diabetes insipidus. Now the next is the edema, which is the accumulation of excess of the fluid in the tissues. When there is an excess amount of the sodium ions, which result in an increase in the volume of the intestinal fluid without the change in the osmoregularity, so that may lead to the edema. So these are some of the common disorders of the excretory system. So this was all about the excretory system and its disorders. These are some of the references.